The end of coding as we know it. The transformational challenge of ICD-10. Presented by DiskRiter. 66 years of information management solutions for hospitals. The Affordable Care Act is demanding broader, greater and more complex, simultaneous and sequential change in the healthcare industry. For hospitals, hospital CEOs and CFOs, other administrators and physicians than has ever been required before, over a decade. This is mandated change at the speed of light. These changes challenge financial stability and security, growth and innovation, internal systems, internal relationships, executives, administrators, department leaders, physicians, nurses. At a time when pressure for expense reduction, staff limits, and operational and financial efficiency is a heavier weight than ever before. It will take, to paraphrase a former U.S. president, all the brains you and your team possess and all the best brains you can borrow. One of the onrushing trains bearing immense and complex mandated change, for which there are expert and trustworthy brains you can borrow, is ICD-10. And the total systemic change in medical coding. D-Day, 10/1/15. In the next several minutes, let's look at coping with the coming coding crisis, intelligently and proactively. Here is the ugly fact. ICD-9 contains 14,025 diagnosis codes and only 3,824 procedure codes, 17,849 in all. ICD-10 mushrooms to 69,823 diagnosis codes and mind-boggling 71,924 procedure codes, 141,747 in all, a 7 times multiple. You already fight errors, lazy use of non-specific codes, information delays. Imagine having it all multiplied by 700%. This is too serious a matter to entrust others to handle on their own, or to be blindsided by at a late date, then saying, "Why wasn't I told that?" when it's too late. You must be directly involved in organizing and implementing, or seeing that implementation occurs, of a truly comprehensive approach. A barn full, floor to ceiling, wall to wall of hay mounds, suddenly replaced with 7 barns full, in which to find precisely the right needle you need for compliant, correct coding. Each mistake in coding can produce hours of extra work for hospital billing and collections personnel, for already overburdened nurses and doctors, for those doing the coding. It won't take much of this to have distracted, irate physicians and nurses, backlogged claims processing. A war between fixing and resubmitting claims versus staying on top of new work. Having no choice but to incur overtime, with the new law governing overtime pay for salaried management level employees in the mix. Cash flow disrupted by delayed reimbursements left and right. Budgets blown up. The CFO unable to hit financial targets. The CEO unpleasantly surprised. His initiatives disrupted. On defense. The American Medical Association calls the costs linked to ICD-10 crushing. The AMA's president said that the markedly higher implementation costs for ICD-10 places a crushing burden, straining vital resources needed to invest in new healthcare delivery models and technology with real value to patients. Why is it so crushing? ICD-10 is not mere addition to the existent codes. It is, as stated in the Affordable Care Act, an entirely new medical billing system. Don't underestimate the pain of complete, all-encompassing system replacement. Don't underestimate the total amount of time needed to replace an entire system. And please don't underestimate the level of expertise you need from involved service providers. Department heads and others will tend to stick with familiar providers and existent, comfortable relationships. It's up to you to be certain everybody your hospital is depending on is worthy of that trust. ICD-10 is hyper-specific. That means codes were written for every medical emergency, condition, and problem the government bureaucrats could imagine. The result naturally includes comedy. There is a code for being injured by a flying saucer, a different code for being bitten by a turkey, and a killer whale, and a squirrel, and for countless other mammals, fish, and fowl, and different bite locations. It might actually be funny if it weren't about to crush your medical records team and traumatize your information management. What do CFOs predict? Pam Hess, CFO of St. Thomas West Hospital in Nashville. I think it's going to cause delays in coding and billing that could affect our cash flow, but I'm not able to predict how bad it's going to be. Gee, that's not good, is it? The CFO is unable to predict how bad it will be. Greg Johnston, CFO, Baptist Health System in Alabama. We will be adding additional coding resources to help with the productivity declines. We're forecasting a growth of 5 or 6 days in accounts receivable as a result of queries to physicians and the time it will take to code with the additional specificity. We are anticipating a cash flow delay. Uh-oh, a need for more staff or overtime hours, and a warning of cash flow disruption. Michelle Mahan, VP and CFO, Frederick Memorial Regional Health System in Maryland. Healthcare leaders may not totally appreciate the enormity of this task regarding ICD-10. This seems like an infrastructure task, so it may be that people aren't worried, but there's more to it. Source: Health Leaders Media Impact Analysis. Becker's Hospital Review 2014 CFO Survey. 71% of CFOs say transitioning to ICD-10 is, far and away, the most important revenue cycle issue of the year. Warning: if you think you got a reprieve with extension from October this year to October next year, think again. Did you give a big sigh of relief when the one-year delay was announced? That's like having your head on a chopping block, the executioner with axe raised, when he suddenly has a back spasm and has to sit down. It's not a pardon. And listen, ICD-9 or 10 or 11, the fact is coding is a trouble spot, period. But the reason this temporary reprieve exists is most hospitals absolutely could not be ready this year. Failure would be so epic it would be mainstream news, and it's an election year. Next October will arrive before you now imagine. Smart leaders will use the executioner's brief back spasm as opportunity. Dumb leaders will use it as an excuse to procrastinate. Yogi Berra said, "It gets late early out here." Where will ICD-10 hit your hospital the worst? Number 1. IT changes. Hardware? Software? Hurried system testing? Failures? Number 2. Staff training. Everybody who even touches code is affected and can negatively impact information as it moves through your chain. That includes frontline employees, people in financial departments, all the way to clinicians and radiology technicians. Everyone who touches information needs identified and trained. Warning: don't leave this in the hands of your hospital's HRD team or department heads. This is no normal or routine training need. This drops a bomb directly on your CFO's ability to control costs, make budgets work and hit financial targets, and on your ability to grow your hospital's capabilities, technology, and size and scope. This explodes a workload bomb in medical records. Number 3. Physician training. Most hospital CEOs and administrators would prefer not having to take physician time and, bluntly, annoy physicians with this kind of paperwork training. But you can have the best coders, and absent absolutely accurate documentation by the doctors, errors and time-chasing information and costs are going to explode with ICD-10. Number 4. New CDI. Clinical documentation improvement throughout. Readiness assessments at hospitals are consistently revealing documentation now being used that isn't specific enough to support the specific code in ICD-10. Assigning a non-specific code will result in serious revenue losses. Right now, you are under pressure to plug up holes revenues is leaking out of. This could blow a big, fat hole in the bottom of the boat. Typically, expense reduction is a reactive exercise. In this case, it must be a proactive one. Number 5. New forms. Hospitals are awash with cheat sheets, charge capture forms, and other rogue documents using ICD-9 codes. These have to be hunted down, ferreted out, removed, and likely replaced. Number 6. Unprepared coders. At DiskRiter, we began more than a year ago, investing time and resources in acquiring and organizing all the ICD-10 related information, and training our coders at a pace they could reasonably handle to get conversant with a 7 times multiplied language. I frankly doubt any hospital has been able to devote a fraction of this time to getting its internal coders or administrators up to speed. Without alliance with an expert team like ours, costs to hospitals will be high and accumulate in a hurry. Unprepared coders inside your walls or lax outside vendors insufficiently prepared represent serious financial threats. DiskRiter certified coders, as well as trainers and coaches, are held to an 8-point expertise standard, unmatched in the industry. Number 7. Failure at compliance. With ACA, with other regulations, with insurers' requirements, failure when audited, generating internal strife, blame gaming, do-over work, which in turn leads to increased costs. DiskRiter preemptive independent audits conducted confidentially on your behalf identify needed fixes before they become uncontrolled, embarrassing, or costly problems. Any mistake in the information management and compliance chains can create delayed reimbursement, reduced reimbursement that slips past unnoticed, losses that in total cripple a hospital financially, transcription, coding, and compliance reporting backlogs, audits and fines, and in extreme cases, lawsuits that can end careers and destroy institutions. DiskRiter solutions, systems, and services are all keyed to achieve 96 to 100% accuracy and compliance. We have built the right solutions. ICD-10 Simplified Implementation, exclusively by DiskRiter, is the answer. We are taking into consideration the new Medicare reimbursement map, new Medicaid reimbursement maps, Blue Cross, other major insurers, and the ACA itself, along with the new ICD-10 code system, to leave no stone unturned, readying to successfully deal with all the different payers. No one has so thoroughly engineered a top-to-bottom, comprehensive implementation approach to prevent the coding crisis from morphing into a financial crisis. And immediately, pre-ICD-10, we can improve your hospital's coding, likely reducing expenses and/or speeding cash flow. Why not let us have a look? There's computer-assisted coding, and then there's computer-assisted coding. Obviously, ICD-10 makes CAC of even greater importance than it has commandeered so far. Through select partnerships, like one we have with AMI, Artificial Medical Intelligence, DiskRiter offers a proven, flexible, and effective CAC platform that can stand alone or integrate with other HIM systems. It is used successfully in hundreds of great hospitals. It is well accepted by medical records personnel and by physicians. And we have brought it up to speed to handle the coding crisis. It's ready to maintain calm amid chaos and achieve accuracy without anxiety. But it is only as good as the humans customizing it for your hospital, the humans installing or upgrading it, the humans doing training, as well as the humans using it, who must be on board attitudinally and prepared practically. In short, neither hardware or software can carry the day. A true holistic approach to CAC is more vital than ever. One caution. ICD-10 has brought experts out of the woodwork, but many are pretty wet behind the ears. Consultants, software developers, and others have seen your problems as their golden opportunities and rushed to present themselves as saviors. ICD-10 and Obamacare sound like gold rush to them. Incredibly, even colleges have hurriedly handed course content to professors and are selling that training at false bargain prices. Do these people actually have the depth of experience you should feel safe and secure in trusting your hospital's financial health and your reputation to? For 66 years, my organization has excelled at helping hospitals confront and conquer one new challenge after another. Since 1947, we've been on hand with continually updated end-to-end solutions for information management. We are not stuck in the mud. We welcome innovators and go out of our way to recruit new thinkers to our team. But then we have them improve our solutions and invent new ones under the watchful eye of the most experienced leaders in this field. In this, we keep you far removed from all the risks of innovation. I say, beware of those who suddenly claim to have smart and affordable solutions to the coding crisis. How to borrow our brains on this, free. ICD-10 is complex, costly, and potentially dangerous and disruptive. I assure you, for our clients, we have thoroughly researched every aspect of ICD-10, as well as having mastered effective, efficient, error-free coding. A brief but well-purposed discussion with us about everything related to coding and ICD-10 with us will be provocative and fruitful. The time to have an in-depth diagnostic discussion about this and your institution's needs is right now. Here's how to schedule an initial diagnostic consultation call, free of charge.